Thanks for tuning in to Thoughts for Tuesday, hosted by Bates Communications, a podcast series about business trends and leadership insights from the experts.
Welcome everyone, I'm Suzanne Bates, and today I have the privilege of sitting down for a conversation with Sandi Fenwick, CEO of Boston Children's Hospital, which is the world's largest and leading center of pediatric medical and health research. Boston Children's is widely regarded as the nation's foremost independent pediatric hospital, and it's the primary pediatric teaching hospital for Harvard Medical School. And congrats, it's just been named the #1 children's hospital in the nation by U.S. News and World Report for the 6th year in a row. That's just amazing, Sandi. Under Sandi's leadership, Boston Children's is developing breakthrough therapies and cures, including gene therapy, driving digital technology innovation, including smart imaging and brain disorders, and expanding into a regional system of care to bring great medicine closer to patients. And they're building the most advanced pediatric care facility in the world to open in 2022. Sandi, welcome. It's such a pleasure to have an opportunity to sit down with you.
Thank you, Suzanne. Pleasure to be here.
So I always like to start at the beginning, before you became the CEO of Children's, before you even began your career. Where did you grow up, and what did you want to be, and what were you good at?
I grew up in New Britain, Connecticut, which was a great place to grow up. When I grew up, it was a place of a lot of first and second level generation immigrants, very diverse, great school system. And I, from the age of probably, at 11, my 5th grade teacher just made science come alive. And I loved it, and that's been my passion ever since.
How do you think your teacher did that? What was it that engaged you?
He was amazing. He was a 5th grade teacher, Mr. Herrick, and I'll never forget him. But he had all of us, boys and girls, so excited. He helped us. He built a house, a dollhouse, and he had us wire it with all electrical outlets, and he showed us how electricity worked. He built an inside of a person, and then he had us have all questions as to which of the body parts were what. All the internal organs, all the external organs. It was just unbelievable. And we all just got passionate about learning science.
Oh, that's amazing. So tell me about your family, your parents. What did they do?
They were amazing people. My grandparents were immigrants, and so my parents.
From where?
From Slovakia. All 4 of them within a 20-mile radius of each other. They all grew up in a very small section of Slovakia, almost on the Ukraine border. They all came seeking better lives here, and my parents were incredible. They taught us virtually everything there was to know about life. Deeply committed to education. Although they never went to college, that was their goal. So my dad worked 2 jobs and my mom one to put us, 4 of us, through college, and giving us a really well-balanced, well-rounded life of church and family and education and giving back.
How many siblings?
3 siblings.
And you are where in the order?
Number 1.
Number 1, of course, the first child.
First child.
The achiever, right?
Yeah, although everyone did really well, and everyone is really happy. 2 of my sisters work with children. One's a teacher, and one works in early child development, and my brother ran his own company.
So you graduated from high school and went off to Simmons College in Boston for undergrad. What was your major, and what did you like in undergrad?
Well, as I said, science was my love, and so I went on to study biology, chemistry, and pre-med, and was headed for medical school and thought that's exactly what I would do. And yet, when I got through Simmons, which was an extraordinary experience, fabulous faculty, really gave women a sense of purpose and a sense of confidence to do what they wanted to do. and to break barriers. And so I decided after graduation that I was going to work before I went to medical school, and then never got there.
So what did you go to work doing?
So one of my faculty members at Simmons, who I adored, they in fact were not all women, they were a mix of men and women, told me about a job at Harvard School of Public Health. And she said, you're really trying to decide whether you want to go to medical school or you want to go to do science. This will give you an opportunity to really learn a little bit of both. And so I got a wonderful job in the lab in microbiology and immunology. And within 2 months was asked if I wanted to go to Saudi Arabia to work in their facility in Dhahran in the hospital. So I was in a hospital setting doing a little bit of research, and in the villages doing both sort of specimen epidemiology as well as a clinical trial. So I got to work with patients, and I got to work with being in a hospital setting, and it was just phenomenal. And I spent 2 years there.
Wow, what an adventure. And I mean, what year was that you were in Saudi? It must have been interesting
so
to be a woman working there.
Everybody's going to be able to calculate how old I am. So this was 1972. It was a really interesting time in the country when it was just a little bit more open. And so I was allowed to go into the villages and looked at as sort of a clinical person. So a lot of opportunity to do that, as well as to visit with government officials when we had to go for approvals to do our clinical trial, as well as to be out there in a really very interesting culture.
So when you came back, is that when you went to the University of Texas?
Yes. So during that time, I realized how much I loved working with patients, but not on a clinical basis. And so came back and did more research in Texas at both the University of Texas as well as Children's Hospital Texas. And ran both a little lab for a physician as well as did some cancer research. And there I realized it wasn't science either. I'm a pretty results-oriented person. I don't have the long-term commitment and resilience that scientists need. And so I decided to get my master's in both public health and administration.
And so once you had that realization, was it difficult for you to figure out what would be next or how to carve out a path?
A little bit. I decided to get my master's, which I did while I was in Texas. I was working and getting my master's. And it was a time when I realized I loved organization. I loved learning about organizations. I loved putting teams in place. I loved driving for results. And I realized that that's really where my strength was too. And so coming back to Boston after finishing, my husband, who I met in Saudi Arabia, was admitted to Harvard Business School, so we came back to Boston. And my first job was at Beth Israel. And it was in a very small department. It was my first management job. And I realized I loved that part of the work. And that's sort of where it started, and it took off from there.
So your first management job, that's something almost everyone remembers very well because now you're responsible for other people.
Right.
Yeah. Can you think about a time when, and I know this is going back a ways, but when you wished you'd done something differently or you made a mistake and you learned something about leadership from that?
Oh, I think it's something I'm learning every single day. And if we're smart, we're always learning.
Sure.
But I think for me, I'm such a results-oriented, as I mentioned, sort of doer, that really building and relying on teams to do and learn how to delegate and learn how to listen and learn how to wait and speak after everyone else has had a chance is something that I think I didn't do that well when I first started. And for me, it's a constant journey and constantly learning how to do that better.
So I think around the time I learned of you, or was hearing a lot about you, you were at Beth Israel, another great hospital here in the Boston area, and in an operations role, a leadership role, but running operations. How did that prepare you to make the leap into a more strategic role? Not that operations isn't strategic, but it's the block and tackle usually of healthcare.
So I think understanding every aspect of how a hospital runs, who contributes to what, how difficult their roles and jobs are, how everyone contributes to the patient experience is something that is so important. And to learn the complexity of what a place like an academic medical center really is and runs, how it runs. And so trying to understand as one moves up and tries to introduce change and how difficult that is because of the diversity of everything from jobs to where people come from, their experiences, how important they see their roles, and how change impacts people so differently. So moving into a strategic role that requires constant adaptation and change is something that you learn from understanding the depth of an operation. And then the second part is how important every team is to the patient experience. And since that's what we're here to do, is to improve lives and to deal with patients in the most difficult time of their lives, to understand how those teams in many different forms come together to support that endpoint.
Sometimes when I'm working with senior executives and they're contemplating becoming a CEO, either in their current company or in a new company, a question that I ask them is, why do you want to be CEO? And that always elicits some interesting responses, but often it's, well, gee, I really need to think about that. So I wonder if you went through that process, if you always wanted to be a CEO or you knew you wanted to be a CEO, and if so, why?
Now, I have had the most wonderful jobs throughout my long time career, both at Beth Israel and now at Children's. And every job and every time period, there was something really exciting that I was working on, and I knew I was contributing and having impact. And so it wasn't, this is a job to get to the next step. It was really something that I thought, for now, this is really a great place to be. One day, if it leads to being a CEO, that would be wonderful, and I would love that. But it wasn't, it was a step to step to step. I also wanted to have a family, and that was very important to me. And so recognizing how you truly have to throw your 100% self into a CEO role, even more so than any of the other roles, because it is 24/7, and you're never off because you're constantly aware and concerned about your organization. I knew that had to be a time that was when other things were in a good place. And so the timing worked out absolutely perfectly for me. And I love this hospital. I love this job. I have the best job in the whole world.
Other than it being 24/7, always present, it is pretty much who you are when you become CEO. Is there anything else that surprised you about it, about the role?
I think it is always surprising to me because I am never one to think that what I have to offer is as important and valuable as the incredible people that surround me. So the physicians, the researchers, the nurses. I mean, I just have such enormous respect and admiration for what they do, what they contribute. And you don't necessarily think that what you have to say carries that much importance or weight. And then you realize what you say has to be thought through very carefully. And as I was just reading yesterday, Frances Hesselbein, our wonderful 103-year-old leader in this country,
yes.
said...
Most people know her from the Girl Scouts, just to explain
right.
to those listeners who may not know who she is. She's a remarkable icon and expert on leadership an amazingly influential woman of our time.
And amazing. She's 103 years old, and yet as sharp as a tack. And she was interviewed a couple days ago, and she said, "Think first, speak last."
I need to learn that lesson too, don't we all? What, as you reflect on the last 20 years or so, what has surprised you most about what's happening in healthcare today?
Oh, I think, for me, there's things that are constantly evolving and changing. And I think the pace and the speed of change is what is remarkable today. Things are happening so fast that you look back over decades and you say, wow, that would have taken 5 years to happen. Now it's happening more quickly. But I'm also seeing things come around. 25 years ago we had capitation. Now we call it accountable care. And so there's a lot of things that we try, we sometimes get some value out of, and then we come full circle. So there's things that I'm seeing anew and things that I'm seeing come back and say, here we go again.
With things changing as quickly as they do, it's very hard for the general public, I think, to keep up with policy, and also for legislators to do so, both at the state and the federal level. What do you wish that people understood more, people in policy-making roles, understood more about healthcare that would make it better for everybody?
Well, first and foremost, since this is the place that I sit in, I just wish that people understood more how important investing in the healthcare and well-being of children was to today as well as to our society in the future. Because, children represent 25% of our population, but they represent 100% of our future. And I keep saying that because I don't think that we always put children, they don't vote, they really aren't where the bulk of the dollars are being spent, but they are truly where we need to continue to invest in their health care and then in everything that surrounds them as policymakers. So when we think about education, or we think about the environment, or we think about society and violence and everything from gun control to immigration, all of those things impact the well-being of children today. And they will be, everybody who takes care of us in the future, everything from our corporate leaders to our physicians. And so I just wish that we could put the care and the well-being of children ahead of some of the things that we're thinking, or at least incorporate them into the way we're thinking.
Yes, it does seem the balance of the healthcare conversation is about the later in life issues, right, that we're trying to solve for. And not that those aren't noble causes, including cancer research, which I know that you did. And cancer affects everyone at every age. But it's hard to imagine how we will be able to achieve a different balance with, as you say, children don't vote.
Right.
I mean, are there advocates out there like you who are speaking about this and making people aware of how we need to change our framework?
Oh, I think there are a lot, but we get drowned out a little bit, again, because our issues are there today, and we're talking about making investments for the future. And everyone today is really thinking so much about immediacy. We don't take the long view on a lot of issues. We take the short-term view, both in our companies. We're looking at quarterly reports, not long-term reports. We think about the immediate impact of success or treatments, even in healthcare, and we're not looking at what are things that are going to be long-term impact and successes long-term. But yes, our association, our Children's Hospital Association, and the children's hospitals across the country have a very strong voice in their local communities as well as at the national level. And then a lot of the societies, the pediatric societies, and parents. I think parents of young children are increasingly becoming more vocal. So hopefully we'll have a stronger impact over time.
So there's so much brain power in this area in Longwood generally, and here at Children's, and it's unimaginable to me, the kind of things people must be thinking about and doing, and the breakthroughs. Can you paint a picture for us of what pediatric healthcare will be like maybe 10 years from now, or do I dare say 20 years from now? I mean, what are the kinds of things that would amaze us to know now?
So I think the most exciting thing that we're beginning to see, clearly if you look back over decades, we've tackled a lot of the infectious diseases, and those are the things that impacted both children and adults. And, in a large part, that's something that happened here at Children's. The polio virus, the measles, the influenza virus, all of those were turned into vaccines that have prevented disease in a lot of people today. Today, we're learning about the genome and genetics, and we're beginning to understand the impact that has on disease. And so in children, so many of our diseases of children are either congenital, they're born with them, or they're genetically based. And we're beginning to understand how modification, understanding first what gene is responsible for disease, how we can potentially modify that gene, how we can then infuse that into a specific patient's own cells and then affect the actual disease. And we're now beginning to see that we can eliminate or cure disease. That's what's so incredibly exciting. And we've done that now at Children's. We've got 18 gene therapy trials going on, 400 clinical trials across all of Children's. Every child with cancer is on a clinical trial today at Children's. And so we are going to be constantly driving both discovery, which occurs in the lab, faster and faster to patients so that we can not just treat but hopefully cure. So I'm hoping that in less than 10 years, we're going to see the impact of this.
That's amazing. So I know your interest early in your career was in leading teams, and as you know, at our firm, we work with lots of CEOs and their teams to help them become high performing. When your leadership team is firing on all cylinders, what's happening? What makes them high performing?
We have so many examples of teams at Children's. When I think about the team that responds to an emergency, a computer system outage or a power outage, and our emergency management team comes together, sets up the command center. We have an administrator on duty who is the lead, and everybody comes and functions, whether it's our public affairs people communicating, or it's communicating across the organization as to what everybody's role is. They're firing on all cylinders, understanding the threat and responding to it. In the OR, our teams are watching the patient come into the operating room every step along the way. Communication, calling out, clarifying questions, going through checklists, knowing there's a leader, the surgeon and the anesthesiologist, but the whole team, whether it's a pump team in a cardiac case or the nurses in every aspect, they're functioning as one well-oiled team for the care of the patient. Our executive teams, when we come together to put goals together for the organization, need to think deeply about what's going to have the greatest impact on patients and families. And then what is it that we're going to do? How do we know how we're going to move the dial? How are we tracking it? And then we're responding and saying we did it, or we're not doing it. What are we going to self-correct? So we have teams literally functioning. Sometimes people move from team to team, but they are communicating well. They're asking each other clarifying questions. They're speaking up when they see things not working. We have trained over 16,000 members of our organization in high reliability, both communication techniques and the like, and they're embedding them in literally everything they're doing, from community health and government relations to the operating room and the ICU. It's a beautiful thing when it works well.
So the medical profession isn't known for communicating well, and I'm curious, and that's non-medical as well as medical professionals. They're all professionals and, of course, amazing people. But what are you doing here that is enabling people to become such good communicators and to perform at such a high level?
So we took on a journey to create a hospital that is truly high reliability about 4 years ago, and literally brought in experts who have done this in other industries, like pilots landing planes on aircraft carriers and nuclear reactor people, so that high reliability is so critical in those organizations. We brought them in and literally started at the very top. All of our senior clinical leaders, our nursing leaders, our executives, every leader of a department, and trained them in techniques of communication, asking clarifying questions, speaking up for safety, calling out when they see something that really is what they don't think should happen, and breaking barriers, breaking sort of hierarchical barriers, and breaking through, hierarchies that people would normally say, I can't really challenge that person. And then training every single individual in that same set of techniques. And now we go out and reinforce it. So every day we have a daily operational brief. Everybody comes in, talks about the challenges or the issues that they're facing, so that there is awareness across the organization of what's going on. And now every team does that at every shift. So it's embedded in the organization, and we go around and do rounds. I go around every other week and do rounds on a unit and ask people how things are going, and so that they understand that this is something that we truly support and are trying to continue to embed in the organization.
Wow, that's an amazing example. Thank you for sharing that. So, what advice, as we head into, wrapping up our conversation today, what advice would you give to yourself if you could go back and talk with yourself on the first day you became CEO?
I think it goes back to what I continue to strive for, and that is be patient, listen more keenly to everyone else, and then give your opinion. I have surrounded myself with the most incredible teams of people, deeply committed to this organization, bringing their expertise and their passion, and making sure that truly they have the tools and the supports and the systems that they need to do their jobs, and then let them go.
That's great advice. Well, Sandi, congratulations on your wonderful tenure here at Boston Children's Hospital. I know that you're going to see amazing and continued great success here, and congratulations on the 150th anniversary of the hospital. I know this is a very important time to mark in the history of this great institution, and let's hope for 150 more years and beyond of great success.
You bet. Thank you, Suzanne. This has been wonderful.
Sandi.